Second thing is access to care. And we hear a lot about rationing, and we hear a lot about denial of services. I'm going to speak about that briefly. But the most important, or second most important thing here is the number of physicians that we have. What they found out in Massachusetts by their universal plan is they didn't have any doctors to take care of the patients that went into the system. We're not graduating any more doctors and nurses today than we were 10 years ago. And number two, nobody is choosing general practitioner anymore. Most medical school grads are going into subspecialty work. Where are our general practitioners going to come from? And this is a system that's catered at general practitioners. In Canada, the general practitioner is the gatekeeper. You cannot walk into a specialist's office in Canada and get an appointment. It doesn't happen. You have to go through your primary care general practitioner to get the referral. And this is the way the US is heading. They want the general practitioners to be managing chronic diseases and only refer to specialists if they absolutely need to. We have probably, in the US, or in Canada I should say, we have about 30% less doctors per 100,000 than we do in the US, and about a third less scanners, MRI scanners, CT scanners. So that's where the rationing of care is going to come from. It's going to come from the loss of numbers of physicians that we have. I'm going to talk about waiting lists, because we hear a lot about waiting lists. The gentleman that mentioned 9 months, that's actually pretty standard in Canada. I talked to my mother on the phone last week, and she was absolutely elated. She got her ENT appointment a year after she asked for it. And she was absolutely elated. She couldn't believe it. She's like, should I keep that appointment? I said, absolutely. It's going to be another year before you get another one. There's approximately 1 million Canadians right now waiting for surgeries. And this is non-urgent surgeries. There's another 1 million Canadians that are waiting to see the specialist to do the surgery. So you're talking 2 million people that are waiting to get care from specialists. Specialists have essentially closed their doors in Canada. The majority of specialists, at least in my hometown, they work 2 days a week. And the reason why that happened in my hometown, in the province of Ontario, was the government decided it would be a good idea to capitate the doctors. We've got to keep costs down. So what they did was they had set a ceiling. Once you get to that ceiling, you don't get paid anymore as a doctor. Now, a lot of specialists were hitting that ceiling at 4 or 5 months. Well, what do you do for the other 8? So what those doctors were doing was they'd have to stretch those 5 months into 12 months. So instead of working 5 days, 4 days a week, they worked 2 days a week. Stretch out the payments. In 1995, the capitation system went in, and a lot of doctors left Canada. In my hometown right now, we have no ENT. We have no cardiovascular surgery. This is a town of 80,000 people. No oncology, no radiation. I think 3 obstetricians. I can go on and on and on, but we have very few specialists. So the general practitioners are running the show there, and they're being asked to manage situations and cases they've never seen before. If you've got a traumatic head injury in Sault Ste. Marie, Canada, there's nobody going to take care of you. They have to helicopter you to Toronto, which is 400 miles south. This is a town of 80,000 people. Can you imagine if that happened in Tyler? Can you imagine a town the size of Tyler with very few specialists? And the general practitioners in Canada, they're so swamped, they have no room to see anybody. The average wait time to get in to see a specialist in Canada is 77 days. The system doesn't work. We already know that. The CMA, which is the Canadian Medical Association, the president has already come out and said this is an insolvent system. It's already going broke. They don't have the money to fund it. They don't have the doctors to take care of the patients. It's pretty sad. I'll tell you some personal stories. My dad was diagnosed with prostate cancer about 2 years ago. And because we don't have oncology or radiation in our town, my dad's 82 years old. The last time he left Sault Ste. Marie was probably 40 years ago. He's a real homebody. He had to board a bus Sunday evening to take him 3.5 hours to the nearest town that had a radiation oncologist, which is Sudbury. He would get off the bus, he would stay in like a Ronald McDonald type house for elderly. He would get his 5 minutes of radiation Monday through Friday. He would board the bus, come home Friday night, board the same bus again Sunday night and go back for the week. He did this for 8 weeks. He's 82 years old. This man's never left his house for the past 40 years. But he did it, and he got through it. And all kudos to him for doing that. But that's prostate cancer in Sault Ste. Marie, Canada. Let me tell you about my mother. This would be about 6-7 years ago. My mother had a really, really bad case of fibroids. Basically what fibroids are, they're large bleeding masses that women get in the uterus. And they just bleed, and they bleed, and they bleed. In the United States of America, I don't know of any person that would bleed to a hemoglobin of 65 before getting care. This is what happened to my mother. She kept going back to her gynecologist and bleeding and bleeding. Let's give you this pill. Let's give you this pill. The protocol says you've got to have this pill. The Canadian protocol says that you have to try this before you do that. So they went down the list, 3 or 4. And when she got to number 4, it was male hormones. And my mother looked at her doctor and she says, "You want me to take male hormones for the rest of my life?" She goes, "My voice is going to get deep. I'm going to lose my hair." She goes, "You want me to?" She goes, "Well, that's what the government says we have to do." So she got me on the phone, and I had about had it at this point. So I called her doctor and I said, "What are you doing?" They said, "Take that uterus out." I mean, you know you have to do it. So she got off the phone, and the next day my mother calls me, and she's sitting in the bathtub, red as anything, just bleeding like crazy. I said, "What's your hemoglobin?" She said, 62. I said, "You better get to the hospital right now because you're going to probably have a heart attack in the next day or so if you don't get there." So she went to the hospital, and with me on the phone, we finally got the on-call gynecologist to take that uterus out. But she had to take 4 units of blood before she did it. And this is the worst part, it was discovered 1 month later that the supply of blood was contaminated with hepatitis B. She's tested negative so far, so knock on wood. Why do you need to take a blood transfusion to have a fibroid surgery? I'll tell you about my grandmother. She had a basal cell cancer on the side of her nose, about the size of a sliver, when she was about 75. But Grandma had lots of other health problems. She wheezed a lot, she had some cardiovascular problems. So they decided she just wasn't a candidate for surgery. So they decided to radiate the thing and radiate the thing. Well, after you radiate a basal cell cancer once, you can't radiate it twice. Well, they just kept radiating it and radiating it because they didn't want to operate on her. She lived another 10 years, but when she died at the age of, I guess, 88 or so, about the half of the left side of her nose was eaten away with this thing. That would never happen here. It would never happen here. I'll tell you about my uncle Carmen. He was a very prominent businessman in my town, and he owned all the radio TV stations, and he had an episode of what we call endocarditis when he was younger, and it affected his aortic valve. So when he was in his 40s, he had his first aortic valve surgery at St. Michael's in Toronto. And about 15 years later, the valve started failing. And so he went to see the cardiovascular surgeon that he'd seen before, and he put him on the list. "You're on the list. You're on the list to get the valve." 1 year stretched into a year and a half, stretched into 2 years. Well, he ended up in the ICU at Toronto General. He didn't make it. He died. I mean, I don't know what else I can say. I've seen it as a doctor, I've seen it as a patient, I've seen it, with my family members. And a less terrible thing, my brother had chronic hip pain. He's a real athlete. And his family doctor put him on the waiting list to have an MRI of his hip joint. Well, he got that MRI 1 year later. He was in chronic hip pain, and he could barely walk. And he's a year older than me and a real athletic guy. Well, they scanned his joint, and they scanned the wrong area. So when he got the scan back, his doctor said they didn't scan the right area. He put him back on the list. 6 months later, he got the second scan. So we're talking 18 months to solve a very simple problem. It was a simple problem, but it took 18 months to figure it out. That would never happen here. It wouldn't. The Supreme Court of Quebec, which is one of the big Canadian provinces, has just recently ruled that it's inhumane to make any citizen wait a year for anything. They've just ruled that. So basically what we're seeing in Canada is an end to universal coverage, interestingly enough. They're going our direction and we're going their direction. Does that make any sense?